What are the two most important things when it comes to stem cells that you should know before you consider stem cells so you can get the maximum benefit? Stay tuned on today's video to find out more. Hello, this is Dr. Brandon Pettke with Lone Star Progressive Medicine. On today's video, what we're going to be covering is the age of stem cells, why that's so important, and what's called the doubling time of stem cells. So if you've seen some of our other videos, I sometimes refer to this video, and it is very important. There's two main things. It's the number of stem cells when we're utilizing them therapeutically with a patient. It's the number of stem cells that we are able to inject, and it's the robustness, as I call it, the liveliness, or in technical terms, it's the doubling time of stem cells. And so how stem cells work is when they replicate, they go through about 65 different cycles of replication. And so what they do is one stem cells becomes two, and then two after a certain amount of time become four, and then four become eight, and then 8 becomes 16, and so forth and so on exponentially. That's how they grow. So the first thing I'm going to cover in this video is I'm going to cover the importance of the age of the stem cells. Okay, and the reason why I'm going to cover that first is because as we age, as we get older in age, we actually have less and less stem cells. And so if we look at some of the research in a newborn individual, a newborn baby, there are about 1 in every 10,000 cells in the body is a stem cell. All right, so it's 1 in every 10,000 in a newborn. Now, as we go up and we look at the teenage years, on average, there's about 1 in 100,000. So it goes from 1 in 10,000 up to 1 in 100,000 in just the teenage years. When we get to somebody in their 30s, it's 1 in every 250,000. So again, another decrease in the amount of stem cells that we have, and that's just in the 30s. When we look at somebody in their 50s, on average, it's 1 in about 400,000. So we've gone all the way from the newborn 1 in 10,000 now up to 1 in 400,000. And then when we get to individuals that are in their 80s, on average, they have 1 in 2 million stem cells. So it's a vast difference, and you can see as the individual age, as I was discussing this, they have less and less stem cells available, all right? Which means they have less and less ability to actually repair and heal and regenerate joints and tissues in the body. So the ideal is the younger we can get the stem cells and healthy stem cells, that would be the most ideal situation, all right? So the next thing I'm going to talk about is I want to talk about doubling time, okay? Doubling time is, again, you remember how I said before, 1 become 2, 2 become 4, 4 become 8, so forth and so on. Doubling time is how quickly or how slowly does that occur. And so there was a research, when I saw this, I was blown away. I was like, wow, this is huge. So there's a Journal of Orthopedics in 2011 did a study, and they looked at the doubling times of stem cells in various age groups. And so they took 3 age groups. One was between the ages of 60 and 75, those individuals, and they looked at their doubling time. And so their doubling time was 60 hours. Okay, so for 1 to become 2, it took 60 hours to become 2. And then it took an additional 60 hours on average to become 4, and so forth and so on. So that was the age 60 to 75 group. In that same study, they looked at the middle age group, and they said 27 to 45. And they said, okay, on average, how long does theirs take to double? And it was 48 hours. So again, 48 hours later becomes 2. 48 hours later becomes 4. So then they took and they looked at the newborn group. And so in that group, the doubling time was 20 hours. Okay, so again, it took 1 to become 2 took 20 hours, another 2 to become 4 took 20 hours. All right, so we had the youngest group, the newborn, was 20 hours doubling time. The middle age group was 48 hours, and the oldest group was 60 hours. And so then in that same study, they said, okay, if we take that doubling time, what does that mean after a full 30 days, a month's time? How many stem cells do we have? So in that oldest group that they did in the study, it was 60 to 75-year-olds. One became, after 30 days, became 200 stem cells. So 1 stem cell grew into 200 stem cells. In that middle age group, the one that was going at once every 48 hours, 1 became, in that same time period of a month, 1 became 32,000 stem cells. So we had in that oldest group, 1 only became 200 stem cells, and then in that middle age group, 1 became 32,000 stem cells. All right, so you can kind of see where this is going. So guess how much it became in the newborn. All right. One, after 30 days, became right around 1 billion stem cells. Incredible amount. 1 to 200 does not even compete with 1 to 1 billion in a 30-day time frame. And so when we look at that, the youngest stem cells that we could possibly get that are the most healthy, that we had the highest numbers, and they're the most lively and robust, that is going to produce the biggest therapeutic outcomes for our patients. And it's exactly why we use umbilical cord stem cells. You can check out another video where I talk about the different type of stem cells that are used in various clinics, but it's those umbilical cord stem cells from live, healthy births, healthy mom, all that type stuff. That's why we use that umbilical cord stem cells, because they have the most robustness, they have the shortest amount of doubling time, and all that means translates to the patient is that they're going to have the best chance for not only getting out of pain, but for maximum regeneration of their tissues. So anyway, that's the two most important things, is the number of stem cells that we can inject in an individual and the doubling time. And so very important things when we're looking at stem cells and when you're considering utilizing stem cells for yourself. So anyway, if you have any questions, as always, you can comment down below in the comment section, or questions or comments for that matter. We'd be more than happy to get back with you. And if you are interested in stem cells yourself, you're more than welcome to contact our clinic. The contact info will be at the end of this video, and we hope to help you in any way we can. Hope you have a wonderful day. Take care.